It's not just the making of babies, but the making of mothers that midwives see as the miracle of birth. And what could be more beautiful than bringing new life into the world? Greetings to one and all. I, Akanksha, assistant lecturer, BIMR Nursing College.
And I, Radha Kanka, lecturer, BIMR Nursing College. Take the opportunity
to accord a warm welcome
to the
participants
for
this
this special
webinar
to
to
celebrate
celebrate International Midwifery Day.
We welcome our chief guest for the occasion, Shri Govind Devraji, Executive Trustee, BIMR Hospitals and Educational Group, and Colonel Dr. S.L. Desai, Medical Director, BIMR Hospitals, our special guest for this event. We extend our heartfelt gratitude to them for having accepted to be a part of this celebration. We feel equally delighted to welcome Professor Suchita Prabhakar, Principal, BIMR Nursing College. Ms. Laila Rumble, Head of Midwifery, Fernandez Hospitals, is our guest speaker for the day. Ms. Laila Rumble is a qualified registered midwife in 2009 and has gained experience within Inner London hospitals in the National Health Service and the UK obstetric private sector. During her career, she had developed a passion for supporting women on their pregnancy journey within both low and high-risk settings. She has been trained in high-fidelity simulation, including obstetric emergencies, human factors and psychology, safety, and maintained her qualification as neonatal life support instructor. To understand the rationale behind incidents, improve practice, and support staff, she moved into the governance role of patient safety matron. Here, she learned the importance of listening and clear structured communication. Ms. Laila's last position was the lead for maternity continuity of carer for vulnerable women. This evidence-based model of care aims to provide seamless care from a primary known midwife and has shown to provide outstanding benefits for both mother and baby. She is now currently the head of midwifery at Fernandez Foundation. To continue her professional development, she is in her final year of MSc in Global Maternal Health at City University, London, and her dissertation topic is Student Midwives' Experience Within the Clinical Environment. We feel honored and privileged to have Ms. Laila Rumble as our keynote speaker on this momentous occasion. We welcome you, Ms. Rumble, once again.
Midwives are the heroes of millions of stories. Every year or on International Day of the Midwife, we celebrate the enormous contribution our nursing and midwifery professionals make in health and social care, our communities and the world. Now, I would like to invite Mrs. Krishna Sharma, Assistant Professor, Department Ops and Gynae, BIMR Nursing College, to enlighten us about the theme of International Day of the Midwife, 2024.
Thank you, Ms. Akanksha and Ms. Radha, to giving me an opportunity to present myself in front of you. Good morning to everyone present here. I, Krishna Kumari Sharma, a midwife from BIMR Nursing College, Gwalior, welcomes you. As we are together here on occasion of International Midwifery Day 2024, the theme of this year is Sustainable Midwifery, a caring for tomorrow's world. Today, I am going to discuss about the concept of midwifery practice. The concept of sustainability in midwifery revolves around ensuring that the practice of midwifery meets the needs of the present without compromising the ability of future generations to meet their own needs. This encompasses various aspects. Environmental sustainability. Midwifery practice should minimize their environmental impact. This includes reducing waste generation, using environmentally friendly products and procedures, and promoting energy efficient practice in healthcare facilities. Next, economic sustainability. Midwifery service should economically viable and accessible to all regardless of socio-economic status. This involves ensuring that midwifery services are affordable, efficient, and equitable, thereby reducing financial barrier to accessing care. Social sustainability. Midwifery care should promote social equity and justice. This includes providing culturally sensitive care that respect the diversity of individuals and communities, and advocating for the rights and autonomy of pregnant individuals and their families. Healthcare system sustainability. Midwifery plays a crucial role in sustainable healthcare system by providing cost-effective, evidence-based care that emphasizes prevention and promotes maternal and newborn health outcomes. This can contribute to reducing the burden on healthcare system and improving overall population health. Professional sustainability. Ensuring a sustainable midwifery workforce involved supporting midwives through education, training, professional development, and creating supportive work environments. This helps to retain skilled midwives, promote job satisfaction, and ultimately improve the quality of care provided. A number of disciplines have contributed to the study of sustainability and resilience in the health workforce and amongst health profession students. Some studies have primarily psychosocial emphasis, focusing upon the individual characteristics of those who appear to be best tolerate working practice common in health professions such as shift work. In the context of midwifery practice, sustainability has been examined in different organizational contexts, in hospital and community settings, and in countries with very different maternity services. The emergence of such research points towards not only the importance of sustainability and resilience to midwifery, but also towards the significance, but also towards the significance of understanding the impact that local condition and working management may have in relation to resilience and sustainability. In the UK, for instance, care is mainly fragmented continuity of carer is rare, and midwife commonly moves around within the hospital and between hospital and community setting, which is potentially disrupt collegial relationship. In New Zealand, women may choose a late maternity care, usually midwife with whom a relationship can develop over time with families. 92% of New Zealand women receives continuity of care from midwife. The other 8% receives care from obstetricians. Led maternity care midwife in New Zealand provides care for women through antenatal, intranatal, and for 6 weeks postnatally. New Zealand midwife can also work within maternity facilities and are also as core midwives providing care to women with complex needs. Relationship of different kinds with women between midwives who work together and supportive relationship within the maternity care system have been identified by midwifery leaders as central to sustainability in midwifery. The nature and scope of such relationship varies considerably across practice arrangements, which may lead to professional sustainability and resilience manifesting differently in different places. Sustainability is about encouraging birth as a normal life process and working at grassroots level to support and strengthen women and families within and as a part of local communities. Yet, wider culture of healthcare provision set the organizational scene for midwifery, and there may be fundamental differences between wider organization culture, especially within the institutional settings, and also and social model of midwifery care. These differences create a tension which challenge workforce resilience and sustainability. Indeed, one Australian study is entitled, "How Can We Go On Caring When Nobody Here Cares About Us?" At the last, we can say that the incorporating sustainability into midwifery practice requires collaboration between midwives, policymakers, healthcare institutions, communities, and other stakeholders. By adopting sustainable practices, midwifery can contribute to broader efforts to achieve sustainable development goals and promote the health and well-being of current and future generations. Thank you.
Thanks a lot, ma'am, for sharing your views with us.
Now it's time for us to hear from Laila. I take the honor and I feel highly privileged to invite her for the session for today and share her proficiency about the topic, the journey of midwives, delivering safe and sustainable healthcare. So over to you, Laila.
Thank you very much. Is it possible for you to enable me to share my screen and then I can open my presentation if that's okay? Lovely, thank you. Okay, so thank you. I'd like to say thank you very much, first of all, to being invited today at the BIMR Nursing College, for inviting me to talk to you regarding a very topic very close to my heart, midwifery. And thank you for the summary that's already been given, is amazing. I'm hoping today's session will be very interactive. So I'll be asking questions and I'll hope you'll help answer me, either in the chat or please speak out. The other thing I'm going to be using is something called a Mentimeter. So I'm hoping if you have your phones ready, you can look at the barcode and help with the questions, and then we can review it through at the end. So as I already introduced myself, my name is Layla. I'm currently Head of Midwifery Services here at Fernandez. My background is, like I say, I've been a professional midwife for actually coming up to nearly 20 years, and I have worked in many clinical areas. So first of all, what I'd like you to do is, can you screen? We're going to see if this works now. So you will need to talk to me and tell me if it works. Can you scan the barcode and then go into the what's it called? Mentimeter. So I'm hoping it works. Please let me know if you've managed to get in. Someone put a thumbs up if they have. Okay. Hopefully we'll see if it continues to work and we'll check it at the end. So today's session is going to cover who's a professional midwife, who's a professional midwife, why do we need midwives, and professional midwifery education and training, which is a course called the PMET, so the impact of the PMET course, and what next steps for advocacy and sustainable workforce. So who is a professional midwife and why do we need midwives? So again, I'm going to try and get you to answer the question. So if you scan in, just bear with me while I stop sharing for a second and we'll go to the next question. I'm hoping this is working for you. Okay, so the next question is going to be, who do you think is a professional midwife? Is it A, a healthcare professional trained in dentistry? 2, a healthcare professional trained to look after animals? 3, is a registered healthcare professional who has completed a recognised training? Or a healthcare professional who was trained to jump out of an aeroplane? There is the QR code again. If you scan that, that should give you some idea, should link you in. Okay. Is it working? Is everybody, can someone put in the chat for me to see if it's working? It's working. Fantastic. Lovely. Thank you. Okay. So the correct answer is a person who is having been to a regular midwifery education program that's recognised, has completed it, and then is registered. Okay, so that comes from the World Health Organization, FIGO, and International Federation of Midwives. So what do midwives do? What's the difference with them? Well, professional midwives view birth as a natural process. They are there to support women, okay? They treat everything as normal, and that's the idea, is that you're looking for normality, and we are the experts at normality, but then have to be highly skilled to be able to know when a woman is, or a newborn is, no longer within that remit. We protect and we enhance the normal physiological birth. We do this by measuring heartbeats, nutrition, careful palpation, needle charting. So we don't only just take on mechanical tasks, but we also look after women's mental health, and we empower them as well. There is a clear scope of practice that we have to work within. We are responsible, accountable. We work in partnerships with women. We support, care and advise pregnancy, labour, delivery, postpartum, newborn care. So a whole range of skills that we have to have. We promote normal birth, like I say, we detect complications. And our main skill is knowing when to refer at the right time, so it is no longer detrimental to the woman or the newborn. We work in unison with the family. Like I say, we're trained to recognise and revert cases beyond their scope. So examples would be if a lady has high blood pressure, if when you're measuring a fundal height, that the measuring fundal height is not collation to the gestation of the woman, if she's saying that she's having reduced fetal movements, if there is bleeding, anything outside of the normal parameters. Obviously, if she's feeling, if it's just normal fears or anxieties that we can help with, so we assure her, and then if we need further advice, then we resource seek it out. So again, I'm going to get you to ask a question, answer a question. What do you think the benefits of professional midwifery are? 1, midwifery care has proven to be efficient use of resources. When educated to international standards, midwives care for essential care for women and newborns. Midwifery practices can improve outcomes for women and all of the above. I just need to go back into the Mentimeter. I just need to stop sharing, so bear with me. There we go, it should work this time. So I'm hoping that you all answered with number 4, all of the above. There is lots of global evidence that support the scaling up of midwifery, ranging from the Lancet series in 2014 to the State of the World Midwifery report as well. These reports were very significant in changing how midwifery was accepted globally. It came through with clear frameworks and recommendations. And it was the numbers that started speaking for themselves. So, safe and effective midwifery care can avert 83% of all maternal deaths, stillbirths, and newborn deaths. When educated up to international standards, 87% of the needed essential care for women and newborns are provided. And within the practices of midwives, it can improve 56 different outcomes. These range from survival, the well-being of women, and also linking in very much to the International Day of the Midwife theme this year is an efficient use of resources. It also, one of the main compartments here, as I've already said, is that it builds up relationships. It's this unique feature, okay, because normally pregnancy provides a woman the opportunity to enter the healthcare system. This may be the first time that a woman has entered because she's pregnant, okay? She may never have been in to see a doctor before or a midwife. So this gives us a unique opportunity to build a rapport, build relationship trusting, empower the women with knowledge, and providing continuity of care, which is a unique feature to midwifery-led care, so therefore women are less frightened. Again, linking into the vital climate change for midwifery, midwifery-led continuity of care we know has a profound impact on women. There is less likely to have regional analgesia, less likely to have preterm birth, reducement in episiotomies. So you can see this has a real impact on women. So why is professional midwifery required in India? As you can see here, the trends in maternal mortality have been reduced. There have been a number of government and public government initiatives following the commitment to respectful maternity care. However, despite the drop, the numbers are still high. In 2021, the data did show that India is on target to meet the Sustainable Development Goals in reducing maternal morbidity rate by an average of 6.6% per year. So we're certainly doing things right. It's heading in the correct way, but obviously this needs to be improved. So here at Fernandez in 2013, we addressed the issue, how could we address it? And we asked ourselves, could we pilot a professional midwifery education and training? So here at Fernandez Hospital, it's been a private hospital for 63 years. However, in 2011, it turned into a non-profit organisation. It did have a traditional approach of the doctors attending every birth, and we had to address the prejudices and fears of the obstetricians. Because if we were going to suddenly make this big change of introducing professional midwives into the environment, it had to change this new working relationship. The first thing we did was I needed to identify what needed to change. The role of the professional midwife needed to be understood by everybody, not just doctors, but all of the team here. And then we needed to teach that to women as well. We needed to make sure that everybody was practicing women-focused care and had to unlearn things and techniques that had already been taught. And at that time, there was no real role model in the country. So we adapted a professional midwifery education and training programme. The aim of the programme was to improve quality and outcomes, to develop and test a model of service provision intended to improve the maternal health care facilities, and perhaps pilot a model that could be replicated across the country. So in 2013, we launched our first batch. These were a range of seven nurses that were GNMs, and we had one auxiliary nurse midwife that had 5 years of experience in the labour ward. And I'm glad to say that at least 50% of these ladies are still with us. As you can see, the graduation marks were very high for all of them. This then developed into the post-basic diploma in nursing practitioner in midwifery, recognised by the Indian Nursing Council. Our first group was in 2017 to 2019, and then from 2019 to 2021. And again, over 70% of these ladies are still with us. So the question is has the professional midwife resulted in an impact on care? So this is quite amazing. When we were looking at our data, actually, now we've managed to integrate midwives to be primary care. Primary care is for women. And this is the impact that we have. So from it started, we've had over 45,000 deliveries, okay, with spontaneous births. And 19,000 of these were birthed by midwives. That is with no support from the doctors. The midwife is the primary care provider. We also then developed midwives to start running OPs, so outpatients. And as you can see from here, over the past 3 years, the midwives have been we've had 3 different hospitals, and we've just recently this year opened another outpatient clinic in another part of the community. They have done 497 consultations. And within the consultations, the midwives give the usual antenatal care, advice, diet, exercise. We look at well-being. And the timings of the appointments are essential. Again, we are screening if there are anything concerns, then we would then do collaborative care with our doctors. And therefore, we work together. So we don't ever leave the woman just with the doctor. We work together as a team. We've also gone on to be specialist clinics for VBACs and breech clinics. As you can see, we've had we run in two different hospitals, and we have a success rate of 19.4% for our VBACs. In this consultation, the midwife will risk assess and give the woman evidence-based care on what exactly are the risks and benefits to a VBAC, what her options are. We also go through different exercises that she can potentially do to make herself well. And again, with the breech clinics, again, we counsel them appropriately with evidence-based information, and again, we might try different exercises. We give them the options on, obviously this has to be in a safe environment and the appropriate type of breech. The other thing that we have been doing is, because of the antenatal care that we provide, through the antenatal care, we then promote very much about childbirth classes, different positions, choices, different birth positions that the woman can be in. We advocate warm compresses in labour. We don't do pushing for we get the woman to, when it comes to second stage, to follow her body. So we don't do active pushing if it's not necessary. And the midwives will only do episiotomies when they're clinically indicated. Not for all, and a clinical indication would be if the perineum was very thick and it wasn't going, and it looked like it was going to tear, then we would do an episiotomy. If it was very shiny, the shiny buttonhole appearance, then potentially we would do one then. So as you can see, I have all the spontaneous vaginal births, 45,000, only 12,000 actually delivered had episiotomies. And only 21%, 5.5% of these were done by the midwives. We're also, this is quite an impact then you can see on the epidural rates. So again, the midwife is there. Again, we have birth companions. We give choice. We do different exercises, 2 or 3 labour, keeping women mobile. We use hydrotherapy here in water birth. So that all helps actually impact our epidural rates. But you can see before midwifery was trained here in Fernandez, we had a 67.2% rate of epidural. This actually significantly dropped. Obviously, it's gone up and down, but we do look at that now with a slight rise that we're looking at is that we think because of COVID and fears and anxieties of women. And the other part of that we looking into is that obviously women unfortunately have got higher risk factors now. So there's higher rates of induction and more comorbidities. So they obviously all come along within the care of the woman. Excuse me. We also have a co-located birthing unit. So this is a separate birthing room adjacent to the main labour room. It's called a located birth centre because it's next door to it. The aim of the birth centre is to provide a less medicalised area with a focus on normal birth for healthy women. This less medicalised space therefore promotes a safe, private environment, enhancing the natural oxytocin and therefore resulting in less interventions. We have a very strict criteria for the midwifery-led unit. The women have to be low-risk, healthy women that are for a midwife's remit for delivery. It links into our scope of practice. We ensure that we monitor women appropriately throughout their care when they're in the midwifery-led unit. So intelligent intermittent auscultation is performed, maternal observations are performed, we complete a partogram. And all this ensures that we are keeping an overview of women to make sure they're safe, that their labour is progressing appropriately. If we need to obviously transfer women, we will do. If obviously there's clinical indication or if a woman chooses to have an epidural. So as you can see here, 71% of the women that were admitted to us delivered on the midwifery-led units, and 28% were transferred. Now, we're quite happy with the transfer rate. This actually indicates that we are a safe unit, so that we are not birthing women that are inappropriate. We are making the decision to transfer when appropriate. And when I mean transfer is that we literally just walk them round a corner and they're on the obstetric unit with our doctors. First-time mums were a high significant admission rate, well, more than multips. So we're now working very much on our multigravida population to try and understand why that is. Talking about transfers, as you can see here, the highest percentage was for an epidural, and as we said, that's absolutely fine. That's a woman's choice. But 50% of the women that we did transfer still went on to have a normal delivery. The second was for meconium-stained lycra and pyrexia. Again, this is good because we're showing that actually we're being a safe unit by identifying any criteria that is outside of a midwife, that is not normal physiological event. Yeah, so meconium, pyrexia, fetal heart changes, prolonged second stages, these are all not normal physiological events, so we then transfer over. The one thing we do is that we advocate different positions. This is woman's choice where she feels comfortable. We also engage birth partners a lot as well to help, and this is to do with childbirth education. Really explains to women what the different positions they can use, and we will encourage women to move around. 960 are propped up, so semi-squatting or propped up on the bed. Left lateral is quite a natural position for women to be in. They feel comfortable there. The idea again is that when we have different positions, this is obviously they're opening the pelvis more. It's more natural for women to bear down. It's easier. We use very different techniques. So using rebozos or a scarf to help women pull against helps them bear down. We'll use birthing balls, or we'll use the chairs so they can squat. So you don't have to have special equipment. It's all the equipment that we have that we've got in the room. We also offer hydrotherapy, and water birth. So this is labouring in water. As you can see here, women feel very relaxed. We have a lovely picture here on the right. This lady was so very happy that she had a water birth supported by her partner. The water does two things. It acts as a buoyancy for the women, so it's more comfortable, and the warm water is relaxing. It is perfectly safe to be used for a birth. But again, that's when we come back to our monitoring, our progression, and using the partogram to make sure everything is progressing properly. And you can see here the joy of women. These are just a couple of pictures here to show you the different positions that we use to encourage women to birth in or labour in, antenatally as well, to start doing exercises to help them to remain fit and well. And you can see here how we really involve the birth partner, encouraging them. They give encouragement and they give massage and just emotional support as well. We do key performance indicators to make sure that we are meeting our requirements and to make sure that we're not slipping anywhere. And if we are, we would look at why. So these are quite high. We're quite pleased with these. 94% skin to skin. This shows that when the baby is first born, it is placed onto mum's tummy and skin to skin is initiated straight away. So yes, we still dry the baby, or we do assess the baby, but it's all done on mum's abdomen. 91, this obviously, the reason why this is done is that it, as you well probably know, that this then encourages breastfeeding and it encourages bonding. It also reduces neonatal resuscitation significantly because of the mum's heartbeats, and the area that mum's chest area is warmer, so it helps babies automatically adapt to life. The other one is that we do delayed cord clamping, either up to 3 minutes or when the cord has stopped pulsating. This is to ensure that baby receives all the adequate blood and reduces anemia in newborns and later on in life. As you can see here, we do collaborative care. This is our doctors looking at babies and how we really promote talking to women and engage them in our care. So I'm just going to play a short video for you regarding one of our midwives and our midwifery-led unit.
Laila, excuse me. The audio is not. We cannot hear the sound.
Oh, okay.
Yeah, yeah. If you could work on that, please.
Yeah, give me 2 minutes.
Sure.
I do apologise, I can't get the sound. I'll play it again and see if it works one more time for you.
That's okay. That's okay.
Is this working?
Not audible.
Can you hear it now?
No, I'm afraid it's still not working. Still
Still not
audible.
working. Okay, no worries, I'll move on. Don't worry.
It's there, but it's not stable. It's coming and going, and it's not high enough.
Okay, no worries, I'll move on for you then. Don't worry, otherwise we won't waste time. Thanks. Oh, that's a shame. It didn't work. I do apologise. Okay, so that was the end of our. So basically, we trained professional midwives, and basically, Gizmo was just there showing you our midwifery-led unit and how the remit works there. And 2017, Telangana State started training professional midwives across the state, and we were part of the training team that did that here in Fernandez. Also in 2009, we started looking at not just midwives, but also National Midwifery Educators Training Programme at the NMTI. And this was to build on the Nursing Midwifery Count Practitioner. And this was brought in by the Indian Nursing Midwifery Council, and they gave us a scope of nursing of a practice area. We had our first two batches, as you can see, and these were from a number of different states, including Telangana. The aim of the training, okay, was to promote respectful care, to show childbirth classes, exercises, include the birth companion, show them roles and how they can support the woman. We made advised changes in the antenatal clinic. As you can see here, how the changes were and introduced protocols. I think the big message here was small steps can give hope. We also established maternity-led care units in Telangana. And as you can see, this is very much about the birth environment. So it was to promote a woman feeling safe. And these, you can see the positive affirmations on the wall. This encourages women. This helps them be mobile as well, because we get them off the bed and walk around. And again, the privacy. So the impact on this within women in Telangana, it means that 16,000 women have birthed in different positions. Only 5,000 babies were resuscitated and 23,000 women took childbirth classes. The impact across the state this has actually shown us that this is not just obviously with professional midwifery, but with all the other Indian government public health initiatives, has reduced the caesarean section from 60.2% down to 54%. And obviously this has then increased the normal birth rate up to 46%. Working alongside this to building professional midwives is also guidelines on a midwifery-led unit and optimal birth positions. These help ensure that everybody is providing the same standard of care and that it's evidence-based and that it provides a safety for both the healthcare professional and the woman. So we know that midwifery-led care is high quality, cost-effective care. It increases maternal satisfaction. It reduces the caesarean section rate. It also increases maternal bonding and breastfeeding. So the way for us to go forward is one of our challenges that we overcome, and this is what we're building on, is the obstetricians are accepting of midwives as colleagues. We're all trained at a high standard amongst us, all of us, and it's actually we should be all looking at collaborative care. We should work as a team with the family involved, and this ensures that safe care can be given. Having evidence-based protocols provides clear evidence and guideways, career pathways also for midwives to progress so that they can feel wanted and valued. Further legislation, and it's mainly building on enabling environment for both healthcare professional and the woman. Okay, so before we go, any questions at all? I'm going to stop so that I can stop sharing for a second. Any?
Okay, so Laila, are you expecting questions from the audience right now?
Yeah. I was going to just go back to our what a midwife means to everybody, but I was just before I go back to the finishing off. Are there any questions?
Okay, so all the attendees of this session are requested to post their questions in the chat box if they have any queries to put up to Laila, and she'll be very happy to answer your queries. So please type your queries in the chat box.
While everybody's thinking about it, I'll go and find the results from what everybody thought a midwife was. Can we get a recording of the webinar? Is the first question. You'd have to ask the organisers this one. I'm happy for you to get a recording. Sustainable midwifery approach. So the whole thing of the collaborative care will very much give you sustainability. So because midwives promote physiological birth, there are less interventions. So Ruta, thank you for your question. Less interventions. So you'll have, obviously by reducing cesarean section rates, okay, so it's sustainability of that point of that less intervention is needed. So it needs so less intervention, reduces cesarean section rate, so therefore the woman will recover quicker, so there's less time needed for healthcare professionals, there's less risk of infection, so that she won't need to come back into hospital potentially. Also with the equipment that's used, if it's a normal birth, there's very limited equipment that you need compared to how cesarean section is. The other thing is that in breastfeeding rates are increased, so therefore then babies are then healthier because of all the goodness from the breastfeeding. Okay, how does a midwife address cultural and social factors that may impact the health outcomes of their clients? So that's been a very big thing for me, obviously coming to India. I think the midwife role, one thing I've very learned here is actually it doesn't matter where you are, it's actually listening to the woman, being part of them, being part of their journey with them. And I think that's what comes with continuity of care. If you can have a midwife or a group of midwives that look after the woman all the way through her pregnancy, intrapartum and postnatally, then we know definitely the outcomes are better for her. The social factors, it comes with it of such that you are addressing all of her needs, and it's again the cultural aspect of that it's addressing the family as well. So it's getting, you know, antenatal period, it's about education and explaining to her and to the family as well what impacts care, what can help her have a normal delivery, how she can achieve that, but also that, you know, there are times when interventions are required, and to make it a safe option for her. And that's where it is. It's about actually listening and, you know, listening to her fears, her anxieties, and understanding why, where is it coming from. A lot of it will be because it's a lack of knowledge. It could be if it's her first time baby, she does not understand what's happening. So actually that having a kind face and a just one person just listening to her and reassuring her, and actually, you know, it all goes into the whole thing of informed consent, that everything we do we explain and we gain consent before we touch a woman, before we do anything. And it's also the one thing that really has shown to me here in India is that I would explain something to someone and I would say, oh, do you understand? And then everybody would nod their head. And then I would work out later that they didn't understand me. So I've now sort of reworded how I look for women and how I check with women. And I say, could you explain to me what you understand? So therefore, I am knowing exactly what her and the family will understand, is the big thing. Can you please tell me what are the best practices in midwifery? I think as long as you go by national guidance, World Health Organization, excuse me, intrapartum guidelines, excuse me. You know, the global guidelines are there for a reason. They give us parameters, they give us guidance, they give us evidence-based practice. So I think, you know, if we stick within those, I'm very much, I agree with them as such that I like governance. So I agree with, you know, I like guidelines, I like policies, You know, everybody should be involved in agreeing what they should be for your unit, from doctors to midwives to neonatologists to, you know, postpartum nurses. Everybody should be involved in that making. So the question is it possible first delivery of C-section then go for a normal delivery? Yes, it is. And I have supported many women for a vaginal birth after a cesarean section, as long as it is done safely. So you're monitoring throughout the labour, you're looking for signs of that she may be distressed, pain, anything like that. The one reason with a cesarean section everybody thinks is the dehiscing of a wound, but actually she's at higher risk of that in the antenatal period rather than the intrapartum. So yeah, absolutely, I've supported women for a normal delivery after a cesarean section. Happy International Midwife Day, says Christina, to all the midwives throughout the world. Thank you, Christina, and happy International Midwifery Day back to you. May they all bring a big change in reducing mortality and morbidity in mothers and children, making healthy families and societies. Absolutely. And what's been really lovely for me is actually reaching out for here and across globally with all other midwives. Okay, so I'm going to quickly show you what the outcome that you all thought of your questions. So what 17 of you managed to respond, so thank you very much. So what does a midwife mean? So healthy pregnancy, I'm assuming that's birth. Midwives provide education, healthcare, childbirth, ob-gynae nurse, caring, delivering nurse, assists, helping mother, giving care, caregiver. Midwifery plays the crucial role, nurturing compassion skill. Absolutely, all those things I think you've managed to sum up what a midwife is. And you know, I think we all should be very proud of that's what we're doing. So the next question was who did you think was a professional midwife? Yes, you were all correct. It is a registered healthcare professional who has completed a recognised midwifery educational programme. So well done. And finally, the last one was, what do you think the benefits of professional midwife are? So only 7 of you came back with this one. All of them. Basically, midwifery care has been shown, evidence-based practice, that it is efficient and the use of resources. When educated to international standards, can cater for essential care for women, and midwifery practices can improve outcomes for newborn and baby, women and newborns. Okay. And that's when I would come to my final slide, which I think is a thank you slide. Unfortunately, I had a very good video to show you women being interviewed and their views, but I'm very sorry that the videos don't work for you. So, hello, ma'am. What are the opinions of midwives or midwifery students on the antenatal administration of flu vaccine? Yes, absolutely. It is a recommendation from NICE guidelines. It's a recommendation of flu vaccine. I've actually cared for someone that who got the flu, and it's amazing how quickly, when you're pregnant with an infection like flu, actually how you can deteriorate very, very quickly. So yes, recommendations of vaccines are crucial to our role, and obviously that, you know, we have that information that we're building that trust relationship with the woman antenatally, so we can inform them about those. So yeah, we recommend flu vaccine. in the UK, it's likely to be other vaccines as well. So obviously the big one at the moment in the UK over the past few years has been the COVID vaccine. And then I know here it's the TTP. Yeah. So to summarize really is just to say that midwives can provide, low resource care and have really good outcomes. So that does prove that we have a sustainable and advocacy workforce. Any other questions?
Thank you so much, Laila, for answering these questions so patiently. And with your sharing of the experiences, not only just as a midwife, but also the good work that the Fernandez Hospital is doing in this direction. It's a beginning, I think, because in India, still a lot has to be done. And this practice, which is being followed at the Fernandez Hospital, should be taken as an example and a clarion call for integrating the midwifery into the mainstream health care system. So thank you so much. Thank you so much for sharing everything with us.
Thank you. Thank you very much for your time. Enjoy the rest of your day.
No, we still have some of the things going now. We just need 5 more minutes of yours.
Yes.
Thanks a lot, ma'am, for sharing our consciousness beautifully. I would like to call Professor Sandeep Joy, Vice Principal of BIMR Nursing College, for giving vote of thanks.
Good afternoon, everyone. I hope that you can hear. As we draw the curtains on this enriching webinar, I stand here with a profound sense of gratitude pulsating within me. Our journey together through the realms of knowledge and discovery has been nothing short of extraordinary. I'm pleased to be here on behalf of BIMR Nursing College to convey my gratitude to our chief guest, Sri Gwalior, Executive Trustee, who deserves a special recognition for accepting our invitation and providing all the support from the planning till now. We know that due to his busy schedule, he couldn't be with us today, but his blessings was with us. I also extend my sincere gratitude to Dr. S.L. Desai, Medical Director, BIMR Hospital, who is our special guest. He has been always with us for his constant support and guidance. My heartfelt thanks extend to our esteemed speaker, Ms. Laila Rambal, Head of Midwifery Department for Fernandez Hospital, whose wisdom illuminated our screens and whose passion ignited our minds. Your thoughts have not only informed, but also have inspired, leaving an indelible mark on all those who have privileged to listen. Thank you, ma'am. It is indeed been a privilege for us. Your attendees, your presence here today signifies not just your commitment to learning, but also your dedication to growth. We have principals from different colleges, professors, students, and more. Thank you for your active participation, your engagement, the questions, the perspectives that has enriched this webinar. Thank you, Professor Suchita Prabhakar, Principal of BIMR Nursing College. Your tireless effort have ensured the seamless execution of every detail, allowing us to immerse ourselves fully for the exchange of ideas. The diligent organizers and the behind-the-scene crews, your dedication, meticulous planning, and unwavering commitment has been the pillars upon which the event has stood tall. Special mention to Mrs. Krishna Sharma and Mrs. Akansha Jain, and also Mrs. Radhan Kaka. Behind the scenes, there exists an effort of many people, countless individuals, whose contribution often gone unseen, from the technical wizards, ensuring seamless connectivity, to the planners orchestrating every details, the diligence who has been backbone to our success. Let us also not forget the silent heroes who helped at business. As we part ways, let us carry forth the lessons learned, the connections forged, and the inspiration garden. Let us remain committed to the pursuit of knowledge, for it's through continuous learning that we can carve a path towards a bright future. In closing, I extend deepest gratitude to each and every one of you making this webinar a resounding success. Thank you. Until we meet again, our next voyage of discovery. Thank you.
Thank you, sir. Thank you all for making this webinar a success with your presence and participation.
So let's all pledge on this momentous occasion. Let's all pledge to stand with the midwives all over the world and to reimagine the birthing experience together. Thank you all once again. Have a nice
Have a nice day.
Thank you, Laila.
Thank you.
Thank you
Thank
once
you, ma'am.
again.